Well, in today's USA Today, a 50th anniversary article of a Surgeon General report on smoking came out in 1964, and it concluded that tobacco causes lung cancer. And, of course, that led to all kinds of fights and lawsuits and so forth. The smoking rates have dropped from 42% in adults in 1964 to 18% in adults in 2012. And according to the Centers for Disease Control and Prevention, there's kind of interesting stuff. They say that they believed, and this is published in the Journal of the American Medical Association this week, that some 18 million Americans have died over this period of time from smoking, and that, tobacco damages virtually every part of the body, causing 30% of the heart attacks, and smoking raises a risk of 14 types of cancer. And they sort of infer that smoking is the worst possible thing and causes more deaths than anything else. Well, I would disagree with it. I think there's two other categories that cause a lot more deaths. When you look at deaths, injuries, and infections, and by injuries I mean physical injuries, pharmaceutical injuries, those kinds of things, to patients, medical doctors, according to the Journal of the American Medical Association, the Institute of Medicine, and the Federal Centers for Disease Control, each year, medical doctors in America alone kill, injure, and infect 15 million of their customers or patients in their workplace or hospitals and clinics. 15 million a year. Okay? And so how many of you would fly commercial airlines if you knew that they killed, injured, and infected 15 million of their passengers every year? How many of you would go to a particular brand of fast foods place if you knew that they killed, injured, and infected 15 million of their customers every year? Nobody would go. Okay? So why do people keep going to doctors? Well, it's because of insurance. Well, the doctors, the most common cause of death now, they're the number one cause of death in America now, are medical doctors and their procedures. Number two are pharmaceuticals and pharmaceutical errors. We're talking about decimal point errors, choice errors, fulfillment errors, putting the wrong drug in the wrong bottle, that kind of stuff. All those things together make the doctors the most common cause of death in America. And then next, I believe, is nutritional deficiencies. Every cause of death, a natural death, everything we refer to as death by natural causes, heart disease, liver disease, other than infectious disease like Hep C and HIV and that kind of stuff. But deaths from natural causes, just heart failure, Alzheimer's disease, kidney failure, so on, liver cirrhosis, these sorts of things are actually caused by nutritional deficiency. Remember, I did over 20,000 autopsies, 17,000 and some change in over 454 species of animals and 3,000 human beings over a 10-year period on a big NIH project called the Center for the Disease Control in Washington University and the St. Louis Zoo and the Brookfield Zoo and many other zoos around the United States. And the bottom line was, and this book is in the Smithsonian Institute, 1,200 pages to the Smithsonian Institute as a national treasure. The finding was that every animal and every human being who dies of natural causes dies of a nutritional deficiency disease. And the doctors dismiss all that, and they never look at that. And I believe that the rate of deaths from smoking from 42% down to 18%, or the number of people who smoke, and the reason why they figure they've saved 8 million people is not because people stopped smoking. They certainly did because they scared the snot out of them, but because more and more people are taking super juices for antioxidants. They're taking selenium as a supplement. Most supplements today have a little bit of selenium in them, not optimal amounts, but a little bit of selenium, and staying away from fried foods will go a long way towards reducing your risk of cancer. And so they're claiming that it's all because of that law 50 years ago to smoking is bad for you. Well, they forget the general public has now begun to supplement with selenium, okay, and take these super juices from all over the world, get up their polyphenols and antioxidants. These things will reduce your risk of cancer. If you have cancer, in some cases, in the earliest stages, it's just you don't even know you had it. It just kind of goes away because the selenium supports your immune system. Actually, as one of my 8 lawsuits against the federal government, I can say by supplementing with selenium, you will reduce your risk of many different kinds of cancers, and supplementation with selenium also helps your body actually manufacture some of the most fine and wonderful anti-cancer substances in the world. Why wouldn't you supplement with our Youngevity selenium? Why not? It's going to help you do these things. And so I think it's even greater importance that we take our 90 essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, give our immune system, give our body, give our stem cells everything it needs to maintain itself. And now we're throwing in the new product called Immortalium, which is based on 2009 Nobel Prize research. And you'll just be amazed with this stuff. I already had people calling me and say, I've only been using it for 2 weeks, and I feel better, I sleep better, my skin is better, my liver spots have faded and gotten 90% lighter in just 2 to 4 weeks. I mean, it's like crazy, the feedback I'm getting from this Immortalium. So be sure to contact your Youngevity associate and ask for our Immortalium. Ask for the book Immortality. Ask for the trilogy books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy. And learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, aromatherapy oils. That's the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy. And we'll be back with Dead Doctors Don't Lie on the ZBS Radio Network after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, we had the story a while back about the young girl in the Bay Area in Oakland that ended up brain dead and is now in a care facility because she went in to get a tonsillectomy to treat sleep apnea, of all things. And then there were some complications following the surgery. And we've got it happening again, and this time it's a dentist getting in on the action here. The parents of a 3-year-old is now in a vegetative state, according to her pediatric neurologist, Gregory Yen, and says she's in a persistent vegetative state. And the parents are now suing a doctor in a hospital, and they're actually a dentist in a dentistry practice here, as they say. They allege that negligence and dangerous conduct led to the girl with a massive irreversible brain damage. The lawsuit against Lily Geyer and her practice Island Dentistry, this actually happened in Hawaii, alleges that improper medications and incorrect dosages were administered to Finley Boyle, and that all from court documents. And they say it's according to the lawsuit, they say as a direct and proximate result of the medications administered by defendants, the child suffered a cardiac arrest during the dental procedure. It also alleges that there further damage resulted due to improper medication administration, and they say this led to severe permanent brain damage. According to the attorney Josh Nishimoto, says she didn't. Actually, that's the attorney for the dentist. Didn't respond to requests from the press, but they say that in this lawsuit that's been filed, that also alleges that the Geyer did not have a plan or procedures in place to respond to medical emergencies such as the one that Finley suffered. And what's interesting about this whole deal, Doc, is the whole reason why the girl was going to the dentist in the first place. Now, mind you, this is a 3-year-old, Ashley Boyle. The mother first took the daughter to the dentist and was told by this dentist that the daughter, a 3-year-old, needed 6 fillings and 4 root canals. And during the procedure, the patient was actually left unmonitored for 26 minutes, nearly a half an hour. And she had originally gone in for just a checkup, and then when this occurred, she was in for the root canals. And I don't quite understand that, because you probably know a little more about anatomy than I do, Doc, but a 3-year-old is going to lose those teeth when the permanent teeth comes in. So why do a root canal in the first place? It doesn't make much sense to me.
Exactly. They could actually just clean those things out, sterilize the cavities, the caries, they call them. And even the parents could go to a grocery store or pharmacy and get a temporary filling, which is acrylic, not mercury or anything like that, and put it in the holes and prevent these cavities or caries from getting bigger. Now, when you have a 3-year-old with this kind of problem, the odds are she had a gluten intolerance, couldn't absorb minerals, including calcium and magnesium and so forth, and phosphorus. That's why she had so many cavities and dental problems at age 3. And she couldn't absorb minerals. Maybe she wasn't getting any minerals. Maybe she was just eating rice. I mean, I have no idea what she was eating, but certainly she wasn't getting any minerals here. It's absolutely a crime that they're going to do these procedures on that 3-year-old girl for deciduous teeth she's going to lose. And they could have put in a temporary filling and then put a cap on it and all that kind of stuff. It was really inconvenient. And so, this was wrong from the very beginning. And that dentist is in big trouble, and rightfully so. Anytime you do a procedure on anybody, let alone a child. You can't leave them alone for 30 minutes. There's always going to be these emergencies. And so there's multiple frauds. This is one you want to scream, fraud alert, fraud alert, fraud alert here. Malpractice of all kinds. This is going to be a mess for that dentist and that dental surgical facility. And they probably should be closed down as a warning to all the other dentists. Don't even go here because you'll wind up with the same fate as this dentist. You know, the rest of her life in jail and close down the facility. Thank you for bringing that one up. It's just another thing, you know, you got to do all the right stuff so you don't need to go to these people. Take care of yourself. Get a hold of that book, Let's Play Doctor. Mama could have done the kids' fillings herself. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Independence, Missouri. And Doug, you're on with Dr. Wallach.
Hello, Doug. You're on the air.
Oh, hi, Doc. Yeah, I have a neighbor lady that I don't know extremely well, but she's in her probably her low 60s, and she has something called bronchiectasis, if I said that right.
Bronchiectasis?
And she's had that she's had that most of her adult life. Mm-hmm. And in the past, she has been exposed to everything products and has taken the Oxybody, and that's helped give her relief. But she's very fit. She grows a lot of her own food and animals and so forth. And she's probably 5'4", 120 pounds.
Yep. Okay. Now, do you know if she has any skin problems or bowel problems, any irritable bowel syndrome, diverticulitis, any of that kind of stuff?
I'm sorry, I just don't know about those things.
Okay, so you don't know if she has any skin problems either. Well, usually when people have chronic bronchial problems, and bronchiectasis is kind of interesting. It's a disease in which the bronchi are contracted. You know, they may lose 20 or 30% of their internal caliber, and so the airways are smaller than normal, and they have a lot of dried mucus in there, and this dried mucus kind of acts like a ball valve, and you can get air in, but it's difficult to get it out, and there's a lot of wheezing and stuff, and it's difficult to expire air out. As opposed to breathing it in. So it's easy to get it in, but it's difficult to get it out. And so this causes all the wheezing and whistling and all that stuff when they breathe. It's called bronchiectasis. And what I would do you have any idea how much she weighs?
120 pounds.
Yeah, okay, 120 pounds. I'd give her one healthy heart and brain pack per month. Give her a half a dose of everything twice a day. That one will last her a month. I would also get her an extra bottle of selenium, because one bottle of selenium will come with that, so she could actually take 3 selenium at breakfast and dinner. And I would also, and she's going to have 3 each day of the EFAs and 3 each day of the EFA pluses, which help give the lungs the raw materials to make prostaglandins, which help dilate those bronchi. But she's got to get on a gluten-free diet, no fried foods, no processed meats, no oils, no gluten, very drop-dead serious here. Because she's got to be able to absorb these omega-3s. Then, of course, the Oxybody, have her take 2 ounces a day. That's going to give her symptomatic relief. It's not going to solve the problem by itself because she has to get more of these omega-3s absorbed so she can make those prostaglandins to dilate those bronchi so she can get the air out as well as get the air in. And, of course, this is going to require the gluten-free diet. Because in almost all cases of chronic bronchiectasis, this means that there's a malabsorption problem. And even if you supplement with the omega-3s, it's difficult to get them in. And so that's kind of what I would do for this gal. And call us every couple of weeks. Let us know how she does. But she has a very good, bright future. And, 1 ounce of Oxybody twice a day. I'd have her continue that just for symptomatic relief as this is turning around. We'll be back after these messages.
Let's head to Arkansas. And Margot, you're on with Dr. Wallach.
Well, Margot, you're on the air.
Hi.
Hi. How can we help you?
Okay. I have been diagnosed with what's called burning mouth syndrome. It's where your tongue burns constantly and there's nothing they can do for it.
Okay. Well, that's because they're ignorant.
Okay.
Let me ask you a couple of quick questions here. Do you have any history of skin problems, any eczema, dermatitis, psoriasis, or rosacea?
No.
Okay. Any history of chronic bronchitis or asthma?
No.
Okay. Any history of bowel problems? I'm talking about diverticulitis, irritable bowel syndrome, Crohn's disease, colitis.
The irritable bowel, but I had my gallbladder taken out a year ago, and ever since then I have constant diarrhea.
Okay. Did you have any bowel problems before you had your gallbladder taken out?
Yes.
Okay, so what, we're going back to when you were a kid, middle age, or?
Pretty much all my life.
Okay. All right, Shar, what's the basic problem here?
It's a gluten intolerance.
Yep, gluten alert. Yep, no doubt about it. Your underlying problem is a gluten intolerance. And there's many things that will cause this burning mouth syndrome, and they're all nutritional deficiencies. It could be folic acid, it could be B12, it could be B6, and so on. It could be biotin, it could be zinc deficiency. Here's what I'd recommend. What do you weigh, Margot?
145.
145. Okay, what would you start Margot out with, Shar?
I would start her out with just the basic Healthy Start pack with the 2.0.
Okay, the 2.0. Drop Dead gluten-free, very good choice. It would give you a tablespoon of the OsteoFX Plus at breakfast and dinner. It would give you 1 scoop of the Beyond Tangy Tangerine 2.0 at breakfast and 1 scoop of the TT Beyond Tangy Tangerine 2.0 at dinner. The 3 EFA Pluses, 1 at breakfast and 2 at dinner. And then I would also throw in the de-stress capsules for the B12 and B6 and so forth. And then for some extra folic acid and so forth, I would also get the Ultimate Daily tablets. Take 3 of those twice a day, and that will take 1 bottle. And as Shar said, stay away from all the bad stuff. No gluten, no wheat, barley, rye, and oats. Drop Dead, you are gluten intolerant. Do you have any children, Margot?
Yeah, I have 2 children. They're grown, actually. One's 26 and one's 24.
Are they boys or girls?
A boy and a girl.
Okay. Do either of them have any asthma or bowel problems?
No, not really. Yeah, maybe the daughter.
Yeah, okay. Well, she's going to pass it on to her kids. Your son has it too. Get them on a gluten-free diet. Get them on the 90 for life, appropriate their body weight, and call me every 2 weeks. We'll walk you guys through this. But this is a whole family thing because you passed it on to them and they passed it on to their kids. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Georgia. And Shola, you're on with Dr. Wallach.
Okay, Shola, you're on the air.
Good afternoon, doctor. How are you?
Fine. How can I help you?
Yes, my mom is 77 years old, and right now she's in the rehab. She had congestive heart failure. In May, she had a cardiac arrest. She was intubated, and she was on life support for a couple of days. And after that, she was doing well, and then she had another, 2 other episodes of heart failure.
Mm-hmm.
Right now, she has the pacemaker. So
I'm sorry, say again.
She has a pacemaker.
Pacemaker. Okay, pacemaker. I got you. Mm-hmm.
Yes.
Okay.
So right now she's in the rehab.
Okay.
But each time she has difficulty.
Okay. Well, let me ask you a couple questions here, Shola. So, can you give your mother supplements in the rehab?
That I don't know. I would need to find out about that.
Yeah, because basically, congestive heart failure is a deficiency of a single vitamin, and putting in pacemakers and doing all these things and giving her drugs and everything might temporarily relieve the symptoms, but it's still the reason why she keeps relapsing and having continuing problems is they're not getting to the basic root cause of the congestive heart failure, which is a deficiency of a single vitamin. What does your mom weigh?
I think she's 220 right now.
Okay, Shar, this is one for you. Lady, 220 pounds. She has congestive heart failure. And what program would you give her?
Well, for the congestive heart failure, she needs the de-stress immediately.
Absolutely.
And she needs 2 heart and brain packs, basically.
Very good. Perfect. A+. Okay. Char's exactly right, Shola. What I'd like to see your mom get is 2 healthy heart and brain packs per month. That would allow her to have 3 of our Ultimate Selenium at breakfast and dinner. It'd be 1 ounce of the OsteoFX Plus at breakfast and dinner, 2 scoops of the Beyond Tangy Tangerine 2.0. I'd go for the 2.0 one at breakfast, and 2 scoops of the 2.0 Beyond Tangy Tangerine at dinner. She'd get 3 of the EFA Pluses twice a day, 3 of the EFAs twice a day, and then I'd give her 3 of the De-Stress capsules twice a day. It'd be 2 bottles a month, and that's going to support and promote healthy maintenance repair of the heart, the blood vessels, and so doctors get things wrong, and I always get nervous when they have continuing relapses, these types of things, and they're installing pacemakers and doing defibrillators and giving her diuretics to help relieve edema and all that kind of stuff. They're just treating symptoms. They're not really getting down to the basic root cause. Again, if it's just simple congestive heart failure, it's absolutely drop dead, a single vitamin deficiency, and this will get her on the right track. And so it's imperative that you get her on this stuff ASAP, as soon as possible. And then we can work on her weight and all that kind of stuff, but it'd be appropriate if you can, in the rehab center, say, hey, I want to bring my mom some vitamins and minerals. I'll be happy to come twice a day and give her these things, dose at breakfast, dose at dinner, and so forth. And then the doctors will see the improvement in their tests and so forth. They'll wean her off her medication and send her home sooner. Give us a call every couple of weeks if you would. She'll let us know what you're doing. But find out if you can do this at that rehab center, and I would go for it, because their mechanical stuff and pharmaceuticals are not going to save your mom's life. Okay, Doug, let's go to callers.
Let's head to Germany. And Gottfried, you're on with Dr. Wallach.
Hello, Gottfried, you're on the air.
Yeah, Doc, thank you very much.
Yes, sir.
I've dialed in for Imotalium for my auto ship starting from 15th of January.
Okay.
But then I have this serious eye problem with this surgery they've conducted as a result.
Is this yourself? Is this for yourself?
Yes.
Okay.
And as a result, destroying this my glaucoma, what produces the glaucoma and the retinopathy, so I can see.
Okay, well, let's stop there for a minute. What do you weigh again, Gottfried?
170, I think.
Yeah. Okay. So in addition to 2 healthy heart and brain packs per month, which are going to give you the basic stuff for your brain and your heart, and of course your eyes are just an extension of your brain. And then in addition to 2 healthy heart and brain packs per month, 1 full dose of everything at breakfast, 1 full dose of everything at dinner, I would also take 3 of the Ultimate Daily tablets at breakfast and dinner. That'll be 1 bottle a month, and that's to support and promote a healthy blood flow in all arteries and veins, including your eyes and your brain and your carotid arteries in your neck and your coronary arteries and your arteries in your kidneys, all over the place. And then I would also throw in, you could take, your body weight, you could take 3 of the Cell Shield RTQ twice a day, or you might even like the Fucoid Z. Take 3 of those Fucoid Z twice a day, and they'll encourage the production of stem cells. You need to grow some new eye tissue, some new blood vessel tissue, and so forth. So this will encourage and support stem cell activity. And then, of course, we have this new product that's been out for a couple of weeks called Immortalium. You could take a bottle of that a month. It'd be 2 tablets at breakfast and 2 tablets at dinner. And they're designed to assist the stem cells and the chromosomes in duplicating, making more daughter cells, making more healthy cells. And they contribute to a longer life for the end caps of your chromosomes called telomeres. And all this encourages repair and maintenance. And, of course, this is a process. You have to have the circulation. You have to have the absorption. You have to have the right products. You got to avoid all the bad foods, no fried foods, no oils. You've been doing this long enough to know all the bad foods and the good foods and so forth. And so now you have to employ all this stuff yourself. And but you do need to encourage the circulation. That's the Ultimate Dailies are for, to encourage stem cell activity. That would be the either the Cell Shield RTQ and/or the Fucoid Z. And then, of course, you want to maintain telomere health and length and encourage more support of your stem cells through the Immortalium tablets. And you have 2 at breakfast, 2 at dinner. There's 1 bottle a month. And then call us and let us know. And, Shar, you've been taking the Immortalium for how long now?
Basically, shy of a month, because my husband
And what
and my
have you
son
seen personally? Now, you just turned 70, 5-6 months ago?
70, yes.
Yeah, okay, so you turned 70. And what have you seen in using the Immortalium for a month?
In my opinion, in the winter, my skin usually gets drier because of the cold air, and actually my skin has gotten softer to the touch. I can feel it, which is completely the reverse of what cold weather does.
And what about any little age spots?
Yeah, I've got a couple of age spots on the back of my hand, and they seem to be getting lighter.
Okay, so you can see by degree they're getting lighter.
They seem to be getting lighter, yep.
Yeah, and that means that your own immune system is gobbling up this ceroid lipofusin, which is the name of the pigment that's caused by oxidized body fat in your skin, which causes liver spots and age spots, and it can actually go away. And the fact that you're seeing such great results, and when you told me that this morning, I was looking at the back of my hands. I had a few of them, the size of maybe a lintel, maybe 2 or 3 on each hand, and they're going away. And just, like you say, 4, 5, 6 weeks on the Immortalium added to our basic program. Well, call us every couple of weeks, Godfrey. We always love hearing from you. And give us an update on how you're doing. We'll be back with more Truth, Justice, and the Longevity Way after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Texas. And Linda, you're on with Dr. Wallach.
Hello, Linda. You're on the air.
Hello.
Hi. How can we help you?
My father was diagnosed with myelodysplastic syndrome, short for MDS, and it used to be called pre-leukemia, back in September of 2013. They put him on weekly shots of Aranest, 1 micrograms every week to 2 weeks, depending on what his hemoglobin and platelet levels are. Back in September, his hemoglobin started out at 9.6 and his platelets at 108, and it has only gone up a couple of numbers, and it's starting to drop back down to those levels.
Mm-hmm.
So the doctor is looking at... The doctor
you want to do
right
a bone marrow transplant and all that stuff?
Not bone marrow. He's talking about blood transfusion or chemotherapy is what they're considering right now.
Sure. How old is your dad?
78.
Okay. What does he weigh?
200 pounds.
Do you have any other issues? Arthritis, back problems?
Yes, he was diagnosed with PMR, polymyalgia rheumatica.
Mm-hmm. Okay.
And so, yeah.
Okay, now, this myeloplastic syndrome is, in fact, a manifestation of osteoporosis. And, of course, doctors don't make any money with osteoporosis, so they're going to say it's pre-leukemia. And, of course, I'm a pathologist, and I used to see this misdiagnosis all the time. Some of it's out of stupidity, and some of it's proactive to get the money, right? And anytime somebody your dad's age with polymyalgia rheumatica, arthritis of any kind, osteopenia, osteoporosis, degenerative disc disease, all these things, the bone marrow cavity that normally houses all the cells that make red blood cells, white blood cells, and platelets begins to get filled up with dysplastic tissue. This is this dysplasia part, okay? And this is these cells squeeze out the normal cells that make all these blood products. So we're going to go for him for dealing with bone osteoporosis and so forth and arthritis. And so, Shar, what would you give this fella? 200 pounds. He's got serious advanced bone disease. What would you give him?
He needs 2 healthy bone and joint packs.
Perfect. And what would you do to encourage his bone marrow cells to make more red blood cells, platelets, and white blood cells?
Ultimate Daily.
And
De-stress.
Perfect. Okay. So his weight, I'd have him take 3 of the De-stress twice a day, 3 at breakfast, 3 at dinner. I'd give him 3, that's 2 bottles a month, 3 of the Ultimate Daily tablets at breakfast and dinner, that's 1 bottle a month. 2 healthy bone and joint packs, that's 1 ounce of the OsteoFX Plus at breakfast and dinner. 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner. 3 of the EFA Pluses at breakfast and dinner. and 15 glucogel a day, 5 at breakfast, 5 at lunch, 5 at dinner. All that will be able to be accomplished by the 2 healthy bone and joint packs per month. Then don't forget the Ultimate Daily tablets and the de-stress capsules, they're capsules. And this gives the bone marrow all the raw materials it needs to support and promote maintenance and production of red blood cells, platelets, and white blood cells. And, of course, it's going to take a little bit of time. And if there's an emergency, he gets down where he has a life-threatening anemia, he may want a blood transfusion, kind of a one-time deal. But usually by the time those red blood cells will live 120 days, and so the majority of them will live, 3-4 months. It's by that time you're going to get some regeneration of the normal cells in the bone marrow cavity of the bones, and he's starting to produce more stuff. And the reason why he keeps relapsing is doing cortisone, prednisone, and blood transfusions are just sort of temporary symptomatic relief. You've got to get to the basic root cause of this, which is the osteopenia, osteoporosis, and so on. Well, thank you. Give us a call every couple of weeks. Let us know how your dad's doing, because this is actually quite fixable. And thank you so much, Sar. Super job. Thank you so much, Doug and Billy. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.